Of those first 1,000, approximately 60% had antibodies, and this was like, we have that golden ticket in our hand. That's
so like 600 people. Wow. I love you're saying it felt like a golden ticket. This is Borough Park, Brooklyn. As we were walking over here, you said to me, in some ways it's like going back 100 years. Mm-hmm. The largest group of Orthodox Jewish people outside Israel live here in Greater New York. Here it's an old world way of life. Some don't have televisions or computers, says Dr. Israel Ziskin, who is Orthodox himself.
Most of the community are grandchildren and children of Holocaust survivors.
Dr. Ziskin spent part of his childhood here, where he now practices pediatrics. What would you say the average number of children in any given family is?
Probably within the 6 to 8 child range.
Large families in small apartments was part of why this community was one of the first places COVID-19 struck, and struck hard.
Must have gotten one day between 3,000 and 4,000 calls.
Rabbi Yehuda Kazira runs what he calls a kosher Ronald McDonald House here in Lakewood, New Jersey, providing Orthodox Jews with medical support free of charge.
We're the same like everybody else, but many of our religious needs that we practice sometimes can be, sometimes misinterpreted or misunderstood.
In fact, it was the celebration of a religious holiday, Purim, in early March that he believes catapulted the virus into their community.
When Purim was around, we didn't know anything about social distancing, about mask wearing. Nobody wore masks.
Because I think the impression a lot of people have is that the Orthodox community was just ignoring advice. You're telling me that really this all got started before the advice was there to accept or ignore.
100%. They were not ignoring advice. They were not. The community, by far, are law-abiding citizens.
But scenes like this rabbi's funeral in late April, during the height of the pandemic in New York, led many to feel the Orthodox community was not taking social distancing seriously. Some in the Orthodox community made headlines again last month by breaking into this closed city playground.
We are going to keep this park open for all of our children.
With few masks and no distancing, which is what we saw on our recent tour of Borough Park. Is the feeling that it's passed by here now?
Yes. Yeah, I think
do you feel confident in that?
I feel confident in that.
While public health officials would disagree, there is no question the community has tried to turn their high infection rate into something positive. In early April, when Dr. Michael Joyner at the Mayo Clinic told the rabbi that the blood of those who had survived COVID-19 was needed for the national convalescent plasma effort, people quickly stepped forward. The first hurdle, testing their blood to see if they had the antibodies to fight COVID-19.
Literally within a matter of 3-4 hours, we collected 1,000 vials.
The blood put in coolers, taken to a private jet, and flown to the Mayo Clinic. What did it feel like to be on that plane?
It felt like being on a godly mission.
As it turned out, a very successful one.
Of those first 1,000, approximately 60% had antibodies, and this was like, we have that golden ticket in our hand. That's
so like 600 people. Wow. I love you're saying it felt like a golden ticket. Since April, Orthodox Jews have become the largest group of plasma donors, donating roughly half of the convalescent plasma supply in the nation.
So literally in this room is where that seed started to sprout. We used to call ourselves a mom and pop organization, and all of a sudden we found ourselves taking on a national responsibility.
From something ugly, something beautiful. What you're saying is you're trying to give something back.
We live in a closed world, that's the way of life, but wherever we can give a hand, be a beacon of light, it's our mitzvah.
The rabbi and his colleagues have set up drives now across the country. Now, the plasma isn't just being used to help patients, not just for transfusions, but also to be studied. In fact, 8,000 vials have been sent to 10 institutions around the world as they try to study why the virus is so deadly for some people and barely affects others.
A storied football franchise made